we're going to talk about null hypothesis testing, type 1 and type 2 errors, and effect size. Again, this is something that we do before we start collecting our data. So this is pre-data collection and goes back to the model where we conceptualize what we're going to research based on what we already know about the subject that we're going to research from the literature review. We create our overarching research question and then develop our hypothesis that we're going to test. All of this happens prior to your data collection. Once we get into data analysis, you will know what statistical test you're going to run when you develop your hypothesis and select your measurement tools. So while part of this is done prior to data collection, you have to know the end game to be able to set up the beginning game. Now we're going to talk about null hypothesis testing, type 1, type 2 errors, and effect size. Essentially, testing a hypothesis or null hypothesis statistical testing, it's based on a probability that an event is going to occur or not. It's going to be based, an example would be, it's going to be based on the probability that we're going to be able to lower depression levels in individuals who are engaging in cognitive behavioral therapy versus not being able to lower depression levels. Quantitative research and statistics, or the positive approach, we're going to always assume the null hypothesis, always assuming that there is going to be no occurrence of the event or the outcome. We always test the null hypothesis. We're testing against the fact that there is going to be no impact based on what we're doing, because we want to either accept the null hypothesis that there is going to be no difference, or we want to reject the null hypothesis that there is a difference, and so we need to look deeper into what that is. So one example of this could be we want to examine the difference in reducing depression levels between individuals who are receiving therapy A versus individuals who are receiving therapy B. So we want to know, is there a difference in the type of therapy in reducing depression levels? We're going to test the null hypothesis that there's going to be no difference. We're not going to expect a difference in lowering depression levels between individuals taking therapy A or therapy B. As we engage in our research and our data collection and our data analysis, we're trying to either accept the null hypothesis that there is no difference between therapy A or therapy B, or we want to reject the null hypothesis that yes, there is a difference between therapy A and therapy B. And then we go on to try to explain the alternative hypothesis, which those individuals who received therapy A had a greater reduction in depression levels than those individuals who received therapy B. So we start examining why that is. So here is just an example of the way hypothesis may be worded, and I'm going to ask for your forgiveness up front when I throw out different treatment terms. Being a social worker, I am not a clinical social worker, so I don't do therapy, I don't do treatment. I'm very much more the traditional social worker from case management, social justice, that era. I've written out what hypothesis may look like based on the different descriptions here. So like the null hypothesis would be there's no difference in levels of depression at pre-test and post-test for clients who receive either EDMR or CBT treatments. The alternative hypothesis to that is that there is a difference in levels of depression at pre-test and post-test for clients who receive either EDMR or CBT treatment. So we're actually we're going to test the null hypothesis that there's not going to be a difference between the depression levels at pre-test and post-test based on the treatment intervention. The alternative hypothesis is that yes, there is going to be a difference, but remember, we're always testing against the null hypothesis. So the difference we have is we have non-directional hypothesis, which is a two-tailed, and that's the alternative hypothesis up here at the top, that where we just say there is going to be a difference in levels. We don't know in our hypothesis, we're not specifying that it's going to be higher or lower based on the treatment. We're just saying there's going to be a difference. That is a two-tailed, remember the bell-shaped curve, that's a two-tailed hypothesis where your statistical significance can fall into either one of those tails. Now we can have directional hypothesis, and this is based on the theoretical information and the research that we already know. So if we know that one type of therapy is going to be more effective than another type of therapy based on previous research, then we can actually state it that way in our hypothesis. So a directional hypothesis, the first one is a positive direction. Clients who receive EDMR therapy will experience greater decline in levels of depression than clients who received CBT treatment. That's one-tailed. We're saying it's directional. We're saying that based on the theoretical and empirical evidence that we already have between these two treatments, the EDMR is going to be more effective in reducing depression levels than the CBT. Or we could say clients who received EDMR therapy will experience a lesser decline in levels of depression than clients who experience CBT treatment. So again, it's one tail, but we're looking at it in the other tail of the curve. Either it's going to be a positive or a negative. So how I indicated when we talk about in the process model, I indicated that wording and semantics are so important when you're defining your research question and you're defining your hypothesis, because the change of one word can change the whole focus. So you have to make sure that the wording is exactly what you're wanting to explore so that you can set your research up and your data collection up to really test what you're doing. I see this so many times where the wording doesn't match the methodology, and so there's a disconnect there. You don't want that disconnect. So it's so important to really think about the wording of your hypothesis and the support that you have for it from the literature, the empirical support, to then develop your methodology, your data collection tool, and your data analysis, so you make sure that you're actually going to be gathering data that can test your hypothesis. So remember, the normal or the null hypothesis statistical, it's based on the probability. So we select that critical value, that threshold, to determine whether that we're going to retain the null hypothesis, that there is no difference, or we're going to reject the null hypothesis and accept the alternative hypothesis. So we have to set this up front before we ever begin our data collection. And again, we do this based on empirical evidence that we already have for the hypothesis that we're testing. So we have the p-values, and p-values vary from 0 to 1. And the most conventional p-value, alpha, this is the alpha level, the p-value that we use in social science is 0.05. And basically what we're saying is that 5 times out of 100, we are willing to make an error in accepting or rejecting the null hypothesis. So you only care about the scores that are outside the realm of what is expected 95% of the time. You only care about those scores that are going to be in those tails of this bell curve. So that's what you're looking at. 95% of the time, things are going to fall into this normal bell curve. But we're saying that 5% of the time that we're interested in is going to be in those tails. And I like to think about this in terms of our research is 5 times out of 100, we are going to indicate we're willing to accept the risk that we're going to say there's a statistical difference in this testing of this null hypothesis. Let's talk about type 1 and type 2 errors. Okay, because we're in behavioral sciences and even in the hard sciences, I mean, we just can't ever be 100% accurate. There's always going to be a variable hanging out there that we haven't accounted for that could explain a finding that we have. We're going to try to create a study, design a research study in a way where we can get as close to 100% assurance as possible in our findings and in our outcome, but we're never going to be there. There's always going to be the uncertainty, whether it be due to sample methodology, the limitations in our methodology, our measurements. Nothing's ever perfect. I find that oftentimes when we do read the research or we listen to the media, basically, the layperson listens to the media and the media tells them that this is the findings. we take that's 100%. Okay, that's what it is, but that's not true. There's always the possibility of making that error. So in the positivist approach and the quantitative approach, we're trying to reduce as much uncertainty as possible. We're trying to eliminate and control for other variables as much as possible, but then again, we just can't always do that. So in statistics, there's two types of statistical errors that we risk making when we analyze our data and make a determination about the findings. And the first one is the type 1 error. I always have to write these down, type 1, type 2. My brain just really doesn't work this way, but I write them down so I make sure I know the difference between them, because I can't just bring it up on the tip of my tongue and say this is the type 1 or type 2 error. But basically the type 1 error is the false positive, okay? It's when we reject the null, that there is no difference, when actually there is a difference, okay? So this is the error of accepting of alternative hypothesis when the results can be attributed to chance. This is the error, again, rejecting the null hypothesis. We're going to say that, yes, there is a difference here, when maybe there really wasn't. It was just due to chance. That's that 5 times out of 100, we're willing to make a type 1 error. We're willing to say that there is a difference here when there really isn't. So that's what the 0.05 is. And you can actually set your alpha higher. You can set your alpha at 0.01, 0.00, or you may find in your statistical findings that you have a higher level of alpha. So you have an increased confidence in your results. But the standard for social behavioral sciences is the 0.05. That's just the standard that seems to have carried over through many, many years, is the 0.05. So the type 2 error is failing to reject a false null hypothesis. So this would be a false negative, meaning that we don't reject the null hypothesis. We say there is no difference when we actually found a significant result, that the option of when we actually found a significant result due to chance. So the type 1 error is that we're going to retain a null hypothesis when there actually is a difference. The type 2 error is that we're going to reject the null hypothesis when there really isn't a difference, that it was due to chance. So there's a type 1 and a type 2 error. And again, from a statistical perspective, that committing the type 1 or the type 2 error, they're going to be proportional because they're going to be related. So if we decrease the probability of committing the type 1 error, we're going to increase the probability of committing the type 2 error. Again, the alpha level, we commonly set at 0.5, meaning that we'll take the chance of incorrectly rejecting the null hypothesis approximately 5% of the time. And to decrease that, you have to have a theoretical reason. So if you're going to actually say, no, I'm going to set my alpha at 0.01, so only 1 times out of 100 am I going to risk the type 1 error, you have to have some research behind that to say that you have that strong enough relationship between those variables to make that. The type 2 errors are related to analysis statistical power. We're going to talk about that a little bit later. But to reduce the chance of committing a type 2 error increases your analysis power by either increasing your sample size or relaxing your alpha level. And this is going to be directly related to the sample size. If we get a large enough sample size, we're going to find a statistical finding in anything that we're testing. If we just get a large enough sample size, think about that bell curve. You know, the larger your sample size is, the more probability you're going to have a difference there. So we're going to get a statistical significance. So this is a delicate balance in trying to determine just exactly what your sample size needs to be, your alpha level needs to be, so that you can reduce the probability of committing a type 1 or type 2 error and control for as much outside forces as possible. Again, reducing the uncertainty. We want to reduce the uncertainty that there's some other variable impacting the depression levels in our group that we're treating, so that we can say it's our treatment that's making the difference. We're going to talk here a little bit about effect size. I will actually provide another tutorial on how to do a power analysis and how to determine your sample size to get the effect size that you want using power analysis prior to beginning your data collection. But let's talk a little bit about what effect size is. When we talk about effect size, we're actually talking about the relationship between the variables. So we want to know the effect size of reducing depression levels for individuals who are receiving some type of therapy, type A or type B therapy. We can have a statistical significant finding, meaning that in testing our hypothesis, we can find that individuals who received type A therapy had a statistically significant difference in the changes in their levels of depression than individuals who received type B therapy. But the other aspect of that is the effect size. Was the difference so small that in practical real-world terms, there is no meaning to it? So even there's a statistically significant difference, there may not be a real meaning to it because the effect, maybe it was only 2 points lower than the individuals who received the other therapy on their depression levels. So if we take this example and we say we're wanting to evaluate 2 different depression levels within an agency setting. One therapy is more expensive to deliver than the other therapy. So therapy A is actually much more time intensive and more expensive to deliver to reduce levels of depression than therapy B. Craft our evaluation or our research, we determine and we get a statistical significant difference between therapy A and therapy B. Individuals who received therapy A actually had a statistically significant difference in the levels of their depression than individuals who received therapy B. But the effect size was so small, the only difference was that their depression levels dropped by 2 points compared to therapy B. So in a practical real-world setting, individuals who receive therapy B are going to essentially have the same outcome as those receive therapy A. If you're having to make an economical decision, you're really concerned about the effect size. Flip that over. If the effect size, if individuals in therapy A have a significant reduction in their depression levels and the effect size is moderate to large, so you can do more good with therapy A for individuals than with therapy B, then you would have a justification for investing the additional dollars to provide that. So that's an example of why effect size is important. So you're going to need to do like a power analysis prior to beginning your data collection to determine what your sample size needs to be to get the effect size that you want. And you can be looking for a small effect size, moderate effect size, or large effect size. And we'll talk about that much more in depth later, but this is just the overview for that. And I'll give you ways to determine that and through doing a power analysis and using some statistical methods through SPSS. But think about it like that. That's what the effect size is. So you can have a statistically significant difference, meaning that there is a difference between therapy A and therapy B in reducing levels of depression. However, that second component is the significance practical for real world terms? Or is it just minimal? Or is it just 1 or 2 points? Therefore, we need to go with the most cost-effective delivery as opposed to one that is statistically significant, but the effect size is so small. And to do that, you're going to conduct a power analysis. And like I explained, I will provide you with a tutorial on how to do that using SPSS. So it's helpful to calculate the effect size before you begin your study because you need to know what you're looking at. That will help you determine a good sample size for your study using the power analysis, being able to detect that the effect that actually exists. So this gives you more meaning to your research findings than just a statistical significant finding. The statistical significant finding tells us that there is meaning behind what we're examining, meaning behind that null hypothesis, that alternative hypothesis. The effect size is going to tell us how much meaning is behind it. So that's just a brief overview again on hypothesis testing, effect size, and a brief introduction to what power analysis is going to be. What we're going to do for what I'm going to create for the next presentation is using SPSS to explore data with graphs and model assumptions. There's assumptions that go into the statistical analysis that you need to have an understanding for, and then you're going to have to address those assumptions if your data doesn't meet those. So this next step is going to happen in data analysis after data is collected. What we've talked about up to this point are things that happen before the data is collected. So the next presentation will be about after data is collected.